We've had a very busy meeting this year, probably the highlight of which was our CME symposium that we ran in the hybrid ablation, in atrial fibrillation sector yesterday in the D'Amato room. We had about 110 physicians attend live, and obviously we filmed that symposium so that we can use that on demand as an asset that we'll then send out to our database for the EP community shortly afterwards. And then we've also done a lot of filming on behalf of a lot of other clients. I think in total we filmed 4 different symposium at this meeting for various different people, which we'll all be hosting on demand and then promoting to our wider distributed market. And we've also been doing a lot of filming at the PACE rooms, the product demonstration theatres, and a lot of KOL interviews, as we always do at our booth, with physicians that have been involved in studies, in trials and in symposia. Well, it's how people engage with our content now. So in the past, we've been a publisher of journals and written content, which has still got a place in the market. But we found that actually the most engagement we get now is from the videoed content that we deliver and we film at these events. Ultimately, I think that physicians want a combination of ways to engage with content, and we'll always have the written word as a publisher in the background, but digital media, and in particular videoed media, is becoming more and more important. For a multitude of reasons, really. Primarily, clients of ours will always want to extend the reach of the content that they deliver. They spend a lot of money to engage with 100, 200, 500 physicians on the day, and it would be prudent of them to engage with us to extend the reach of that content to 5,000 or 6,000 physicians afterwards. But I think probably more and more it's becoming important because of the UCOMED guidance, which prohibits clients that used to fly physicians out to meetings. It prohibits them from being able to do that nowadays. So attendance at these sort of congresses and events is on the decline, and it just enables us to take the content that these guys are delivering, developing and putting together for those physicians, and we can take the congress content to them rather than them having to come here. What sets us apart is the relationships that we spent years and years and years fostering within the EP and wider cardiovascular community. We are constantly developing those relationships. We have a great editorial board, particularly with the Arrhythmia and Electrophysiology Review Journal. We always come to these meetings to have editorial board meetings. We had one yesterday very successfully with the senior leadership team. And it just enables we're just able to sort of engage with physicians on the content that they want, in the medium that they want to engage with it in. And I think that that's probably one of the better reasons as to why we're successful in what we do. And we also we develop where people want us to develop. So if people say to us we want to do more live streaming of activities, then that's where we go. We've invested heavily in the digital media team, and our capabilities to live stream symposia, live stream expert on the spot sessions, physician interviews has been developed quite significantly over the past year. And actually at the ACC meeting last week, we live streamed a physician discussion where we had 184 physicians engage while we were actually filming and live streaming that discussion on the managed trial. And subsequently we've had another 100 physicians engage in that as an on-demand asset. So, you know, we're able to really go where people want us to go and invest in the parts of the business that are growing. And I think that's probably what sets us apart. So our database is, we're a bit different from most other sort of content providers and content creators in the sense that we have an outreach to physicians as well. We have a global database of just over 75,000 cardiologists, and I say they're based across the globe. 40% of those would be based in the US, another 40% in Europe, and sort of 20% for the rest of the world. And those are based across the 3 areas that we sort of spent most of our time focusing on, which are the heart failure area, the interventional cardiologists, and also the EP community as well. And it's the relationships we fostered with the senior people involved at EHRA and at the HRS in the EP market that's enabled us to sort of grow our reach within the EP community and make sure that the content that we're delivering is as valuable and as current as it can possibly be.